This is Nels Sampatacos with Pro Sport, and today I'm going to chat about different repair options for meniscus tears. So we're going to begin by looking at this normal meniscus here, and we can see how smooth it is. And it's essentially a C-shaped shock absorber in the knee, and that is its normal appearance. So when it comes to options for meniscus tears, there's really two primary ones. The first one is a partial meniscectomy, and that is a trimming of the torn meniscal pieces. The other one is meniscus repair, where we actually sew it together. Now, between the two, partial meniscectomy is far more common, even though we're becoming much more aggressive about repairing meniscus tears in various age groups. So this is the appearance of a torn meniscus, and this is what it looks like after a partial meniscectomy. So this is a trimming of those torn fragments. And that's a comparison to what we see here, which is a displaced bucket handle meniscus tear that I've sewn back, and we can see all those sutures that are holding that meniscal tissue back in place. So that's the primary difference. So we're going to begin by looking at some different case examples here. This is a lateral meniscus tear, and we're going to begin by abrading the edges of that tear with this little rasp, and that's going to promote a healing response. We're then going to use this suture passing device to shuttle sutures around the tear, and then we're going to tie a knot and compress that tear together. And we're going to continue this process as we begin to seal off that torn portion there. So it's a process of piercing the meniscus with a needle, shuttling the suture through, and then tying knots to compress the tear together. And this particular device is nice because it allows for circumferential compression of that tear, which is going to result in a stronger repair construct and help facilitate some healing. So this is the completed repair for that type of tear here. So for this next example, we're looking at a medial meniscus, and this is a peripheral undersurface tear that I'm revealing here with that probe. And we're going to begin much like we did on the last case and abrade the edges of that tear with this rasp, and that's going to promote that healing response. And then we're going to use some new devices here. So this is an implant that consists of two 5mm anchors that can be deployed through two different areas in the tear, a more central area and a more peripheral area. And that allows us to place what we call vertical mattress sutures. Now, there's a preloaded knot in each of these devices that we can tension, and that allows us to compress that tear together once we've placed the device. So in this case, we're placing 3 to 4 vertical mattress sutures on the deep surface of that tear, and that's going to compress it together. And then following that, we're going to actually augment this repair with several more sutures on the top surface. So one benefit of these particular devices is that we can place these sutures without leaving behind any knots in the knee, similar to when we perform an inside-out meniscal repair through a small incision. So here we're just placing that final implant, and now we're tensioning that last suture here. And so now we're just checking that final repair with the probe, and it looks to be nice and stable there. And we can see those sutures placed on top as well. So this next example involves a discoid lateral meniscus with a peripheral tear. So the discoid meniscus has some extra meniscal tissue that we've gone ahead and resected, and then here we can see that peripheral tear in the back portion. And here again, we're just stimulating that healing response, and then we're going to use this suturing device to shuttle sutures circumferentially around that tear here. And in this particular case, we're going to place a total of 6 sutures compressing the back portion of that tear together, and we're going to tie and cut these sutures sequentially as we go. And so again, you can see that in addition to the repair that I have gone ahead and removed the inner portion of that meniscus. We can see that trimmed edge, and again, we know that that extra meniscal tissue can predispose to additional tearing, so we want to go ahead and remove that since we're here performing the repair. And so this is the complete repair there. We can see the undersurface and the top surface very nicely. So this next case involves a tear of the posterior attachment site of the lateral meniscus. It's called the posterior root. And in addition to that, there is some mild arthritis in this knee, as well as some degeneration of the inner third of that meniscus. So this is a bit of a hybrid technique where we're going to use this arthroscopic shaver to debride the degenerative tissue, both on the cartilage surface as well as along the free edge of that meniscus. We're also going to use a device here called a meniscal biter to just create more stable margins of that inner portion of the meniscus here so that no additional tears are formed or propagate along the edge. And here again, we're using the shaver to just clean things up. And now that we've done that, we're going to go ahead and place a couple sutures within that back portion of the meniscus, right where it should be docked down into the bone. And once we've done that, we're going to do something a little bit different here. We're going to drill a tunnel through the tibia, and we're going to shuttle these sutures down through the tunnel. Now that's going to dock that meniscus firmly down against the bone there and give it a new anchor point, essentially. So here's the second suture coming in here, and we've created what we call luggage tag stitches. And then here's a guide that's going to help direct our tunnel through the tibia. So I'm drilling up a guide pin now, and we can see that guide pin right there. And then I'm going to insert a special drill that allows me to drill a 6mm tunnel right at the surface of the tibia, which I've now gone ahead and done. And we're going to remove that drill, and in its place, we're going to insert a shuttle, a suture essentially, that allows me to pull those meniscal sutures down through that tunnel, which we can see right there. So that's going to securely anchor that meniscus down into that tunnel of bone. And this is the final appearance once I've secured that posterior root as well as cleaned up the cartilage. This is another example of a posterior root repair in a knee without arthritis. And we've done essentially the same thing. We've just anchored that down into a tunnel and secured it firmly. This is now another peripheral tear that we can see here, where I've repaired that with a number of vertical mattress sutures, compressing that tear together. Same thing again, this is involving a lateral meniscus, and gone ahead and passed vertical mattress sutures there. This is a special meniscal tear called a radial tear that necessitates side-to-side sutures. So this was a tear that has a harder time healing, but we have had some pretty good success with this as well. So here we can see that. And then once again, we have this displaced bucket handle medial meniscus tear that I've repaired back using a number of different suturing techniques. So that completes the presentation. I hope that's helpful to some folks. This is Nels Sampatacos with Pro Sport. Stay tuned for more and take care. Thank you.